Hi everyone, thank you for joining us. We will get started. So I would just want to say welcome to our Healthy Falcons Falcon Live Chat series. My name is Alex Matos and I am a residence director but work with orientation and new student programs this summer. And I am joined by my colleagues from the Center for Health, Wellness and Counseling. I just wanted to thank you all for joining us today. We will be covering a lot of information and resources, and we'll leave about 15 minutes for questions at the end. If we are unable to answer your question today, we will get you an answer. It might just take a little bit of time. We will also be recording this for our YouTube channel. So if you are watching the pre-recorded version, please, if you have any questions, feel free to reach out to us. We are also joined by one of our lovely student coordinators, so I will turn it over to her to introduce herself. Katie, all you.
Hi everyone, my name is Katie. I am a rising junior at Bentley and I'm studying management with a leadership concentration. And as Alex said, I'm a student coordinator for the orientation program this year. I'm so excited to meet all of our new students coming up pretty soon.
All right, and I will pass it over to my colleagues. Jessica?
Hello, everyone. My name is Jessica. I'm going to let my colleagues introduce themselves as we go through some of the high-level overview for the Centers for Health, Counseling, and Wellness.
Hi, everyone. Good evening. I'm Julia Matthews. I'm the director of the Health Center. We're really excited to be welcoming students back to campus and looking forward to sharing some information about what services we offer to our students at the Health Center.
Hey everybody, my name is Dr. Peter Forkner. I'm the director of the Counseling Center here at Bentley, and I'm also looking forward to sharing information about sort of the mental health services that we provide and offer to students.
And I'm Jessica Greer-Trawa. I'm the director of Wellness and Prevention, so I'll talk to you a lot about our prevention and education programs. So before we get started, although our three offices represent different disciplines and scopes of practice, we want you to know that we work very collaboratively. And we do so by providing direct clinical and psychological services, a lot of prevention-focused initiatives. We work together to support student resilience, and we create a foundation of balance, ethical decision-making, and personal accountability through both our programs and the care and services that we provide. I'm going to turn it over to Julia first so she can share a little bit of information about our Student Health Center.
Thanks for kicking us off, Jessica. And it is nice to hear those words collaboratively, because I've worked with Peter and Jessica for a number of years now, and it's great to partner with them because we really see health, counseling, and wellness hand in hand for us and our students. So we are located right across from the Student Center, very convenient for our students to access care there. So what Peter and Jessica, having heard this presentation many times, said, what do the students really want to know and parents really want to know? They really want to know what services are available to students, to your student who's coming to school. What are the services? Where are they located? How can they access them? Who's providing those services? How much will it cost? And from my perspective, it's also important the piece of collaborating with primary care providers at home. So let me just briefly go through what the services are that we offer. This is available, our health center services, for all full-time students, regardless of kind of insurance. Appointments are typically scheduled by phone. We're anticipating continuing offering telehealth services, and based on what we'll be seeing with COVID rates locally, we do hope to offer in-person care as we did in the spring semester. After hours care, we're open Monday through Friday, regular business hours, but after those hours, early morning, late night, overnight, weekends, our university police are always available 24/7 at that phone number, and they are just across the street from us on campus. So who are we? We are a nurse practitioner-led health center. We have nurse practitioners providing care, as well as a consulting physician. We also have an immunization coordinator and nurse on staff typically. What do we see at the health center? Soup to nuts. Someone might come in because they hurt their ankle, that they have a skin rash. They would like to do some routine testing for sexually transmitted infections, would like to get contraception, just need to do some preventive health care. We're there for all of those types of services. We also, as nurse practitioners, are very interested in providing health education. We know that we're meeting our students at a very particular time in their growth, that this is a time that they're transitioning from maybe their parents taking them to healthcare appointments, and now it's their turn to become more independent. And we recognize that even though they are adults, they may need some help and support to get the care that they need. And we really try to educate them to go off into the world to really access care outside of the health center. We can do lab testing, we provide immunizations, we'll talk more about that. We can provide prescriptions, and we have a good network of referrals locally of people, services, physicians, nurse practitioners, the sort of the level of specialists that sometimes students will need. All of our services are confidential. If a parent calls to find out if a student has been seen at the health center, we'll typically ask, has your student given you permission? And we'll usually just call the student to make sure that we have permission before sharing information with a parent. And a student is able to do that also to get their health records later by just completing forms. So just being very clear, our services are confidential, and our students should feel assured about that. Office visits are covered by tuition. Prescriptions, like any doctor's office or healthcare office you'd go to, is a copay typically based on your insurance. Immunizations can be charged to health insurance, and we can tell you a little bit more about the health plan that the university offers to students. It's through Blue Cross Blue Shield. So visits to the health center, a student doesn't need to pay a copay, but any lab tests or if they're sent for x-rays, those would be billed to their health insurance. As I said, our hours Monday through Friday, 8:30 to 4:30. After hours, we have Newton Wellesley Urgent Care Center very close to campus, and we also refer to Newton Wellesley Hospital, and that is also within 10 to 15 minutes from the campus. We have a great relationship with our university police, and in most cases, they're able to coordinate transport to the local hospital in urgent care. In terms of health insurance, it is required in Massachusetts for all full-time students. We have an excellent plan through Blue Cross Blue Shield. International students are required to enroll. Students who live out of state that may have some parameters on their insurance may also find it advantageous to enroll because it is really excellent coverage. It's pre-billed for international students, but it can be waived if other insurance proof is provided. This deadline for domestic students, they must enroll by August 1st. I won't go into too much more detail, just to say it is an excellent plan, but there's more information on the University Health Plan's website that's noted there. And we have a great contact who will get on the phone with you, answer your emails, any questions about that, happy to provide more information. This is the cost of the plan for 12 months. I think it's actually maybe a little bit, I think it's 2,000. I think we may have changed that slide. Anyway, it's around that amount. No deductible in-network, $20 for telehealth or physician visits, $50 for emergency room, and the copays, as you can see there. So for exact information and rates, I would suggest going to the University Health Plan's website. And dental vision is also available. That information is also on the website. Tuition insurance, there is more information on the website. I do not believe it's being offered this year. And any questions about that, please just reach out. Okay, in terms of immunizations, the deadline for submission, we're past it, but we certainly are following up with our students currently to get the routine immunization information into their health portal so that can be verified. And that is a requirement in order to be on campus. So you can see there are required and there is recommended. What's not noted there is COVID, and we'll look at that on the next slide because I'm sure that is of interest to many people. This year, the COVID-19 vaccine is being required. The deadline is August 1st. We are slowly approaching that. It's on everybody's minds. Right now, we are accepting FDA and WHO accepted vaccines, like most universities in our state and across the country. Assistance will be available for international students who in their home countries may not have access. So there will be on-campus clinics on August 26th and September 2nd and 16th. Our domestic students should have access to that, to the Pfizer, Moderna, or Johnson & Johnson vaccines that are widely available in the US. So they should be able to get that vaccine completed and upload that information, and we'll get that verified for them. There, of course, like any vaccine, there are medical and religious waivers. If a student falls into that category, a medical waiver requires a letter from their healthcare provider, and for a religious waiver, there is a supplemental information form that must be completed and will be reviewed. The only folks that are exempt from the COVID-19 vaccine is if you're not coming to campus, and that would be our fully remote graduate students. So just to be clear, for students who are coming to campus, they do need to comply with this policy. And there's more information. There's lots of questions around this. Happy to answer any. And there is a whole web page dedicated to vaccine questions because it is so new for everybody. There's lots of questions around how to get that done, and we're happy to help with that. Any questions, you can reach out to compliance services at Medicat, covidvaccine@bentley.edu, and I do encourage you to look at the frequently asked questions on our website. This gives a brief overview. All of that information is on the website, so I won't take time. The only thing I would say is that students are asked to upload a scanned paper form that has their immunizations on there and signed by a healthcare provider. And then they also are asked to put in the dates of each of their vaccines. All of that information, again, is on the website. This is just a sample of our health portal page. So you get many people may already be familiar with this, but when you get there, you are directed through the process on the health portal. Okay, and just in terms of COVID updates, in terms of pre-travel requirements, as we've done throughout the pandemic, we're relying on the Centers for Disease Control and those guidelines. All travelers must have a PCR test, a COVID test within 3 to 5 days of arrival, and those who are unvaccinated would also quarantine for those 7 days as well. The screening test program that was very successful last year and kept our campus safe will be up and running again. We are monitoring local conditions. We'll be monitoring our test results, but students will be tested upon arrival and then weekly thereafter for anyone unvaccinated. And it may continue based on what we'll find from those results in local conditions. An important point for everyone is that just like on the Bentley campus and outside of the Bentley campus, it's important to monitor your symptoms and to know if you do have any symptoms to get tested and to contact your healthcare provider. If someone on campus is symptomatic, we'll be happy to do diagnostic testing at the health center. In terms of some of the quarantine and isolation procedures that we had last year, we're in a better place this year, given that if someone is vaccinated right now, they do not need to quarantine as long as they are asymptomatic. This again will be coordinated through the health center, and the contact tracing will also be coordinated through our COVID response team. So as I mentioned, lots of information on our Back to Bentley website. Make sure your contact information is up to date. Make sure your phone number is in there and that you've opted in for texting. And know that we're here for you. We're again looking forward to keeping our campus healthy and safe. Insurance questions are there at the university health plans. Any questions about anything else related to the health services is there. So another important point for students is to make sure they bring their health insurance card with them, keep that with them, and find out about how your insurance works before you come to campus. And any questions around anything, feel free to email me or my team. And the compliance services around the vaccine are also very responsive and helpful. Thank you.
Hey everybody, again, my name is Peter Faulkner and I'm going to be telling you about the Counseling Center. I'm the director there, and the Counseling Center is a place where we sort of offer mental health services to all students. And over the past year, we've learned a ton about mental health care during a pandemic. So I'm going to go over some of those things, but the one thing I sort of want you to remember is that in order to make an appointment, we ask that students call our main number, 781-891-2274. I'll go over this in a minute, but something some good that's come out of the pandemic is that we had the opportunity to test telehealth services, and we found that it's been highly successful, and it's been a great thing. And so I'm feeling really good about that. But right now we're still determining what makes sense with regards to telehealth services, in-person services, and we're still trying to figure that out as the year is coming to a start. And so the most important thing you can remember that's not going to change is that if you call that number, you'll be able to talk to, first of all, Linda, who is one of the most pleasant people you'll ever have the opportunity to speak to, but also she'll be able to either answer your questions or direct you to one of the staff. So who are we at the Counseling Center? Well, we have 5 licensed psychologists, including myself. So these are our psychologists who've been licensed by the state of Massachusetts to provide mental health care. In addition, we have 3 we take on 3 students from other universities who are getting their doctorates in psychology. And so they are also helping us out with the service of students. And then, as I mentioned, Linda, our administrative assistant, she's helping us out with everything else. So what is it that we can do at the Counseling Center? So this first sentence is pretty intentionally vague. So I like to say that we meet with all students who experience mental health related distress. And the reason I say it that way is that I want students to know that their issue is not too small or too big to be seen by us. In fact, we are a good place to start when students are struggling with something and trying to figure out what is the best path for them forward. So when you call, when that student calls to make an appointment and meets with one of our staff, we are going to be doing some sort of assessment, talk to that student, see what's going on, get a sense of some history. And then at the end of that appointment, we're able to make recommendations. And that could be continuing to meet with one of our providers, but it also might be that the student is better served by meeting with another department or participating in one of our groups or workshops. And or for certain students who sort of fall outside our scope of care or need more specialized or long-term services, then we're going to be helping that student get help with a referral. But more specifically with regards to what we're able to provide is that we provide short-term individual and group counseling. So for students who it seems beneficial to meet with one of our psychologists or one of our doctoral students for individual services, then they'll be able to meet with them on a short-term basis to help them get back on track or get to where they need to be successful. A lot of questions that I'm often asked the question, well, what does short-term mean? And to be honest, I intentionally don't put a number on that because it turns out that some students do better with just 1 session or 2 or 3, and that some benefit from 8 or 9 or 10. And really it's depending on the need of the student. But like I said, we have the staff are experts in college mental health and are really able to help that student figure out what it is or help figure out what would be best for them going forward. One other thing, I do like to mention that we have a psychiatrist on staff if appropriate. I mention this because this psychiatrist is reserved for those students who have never been on medication. So maybe we're meeting with a student for a little while and it seems like they might benefit from a consultation with a psychiatrist. Then they're able to meet with that psychiatrist and determine, would a medication intervention be appropriate? And the reason I want to bring this up is that for those students who are already on medication, be that ADHD medication, or maybe they're already taking some sort of mental health medication, unfortunately, we're not able to provide ongoing med management. So I like to mention that, so that if you have a student, if your student is on medication, then it's best to continue with the provider that the student is currently getting the medication from. Or if it's challenging and you need to find a new provider, then you're able to call us and we're able to give you some referrals to find somebody in the area. So as I sort of referred to earlier, there have been so many changes since COVID-19. And if you had told me a year and a half ago that mental health care was going to become completely through a computer screen, I would have told you it would have been an absolute failure. And the truth is that it was an incredible success. We learned so much about how to deliver effective mental health care through our telehealth platform. And in assessing our students at every semester, at the end of every semester, I give our students a satisfaction survey, getting their sense of how things went. And I'm not exaggerating to say that both semesters in the fall and the spring, students reported satisfaction levels that were higher than any other semester that we had offered services. So clearly they really enjoyed those services. Additionally, the reported efficaciousness of the services, so how effective we were, students were reporting that they were actually getting better, more with telehealth services. So those are two great things. But more than that, we found that the students, when surveyed, also said that they wanted this to remain a piece of their care. So even when we're no longer forced to be seeing students remotely, students want that part of their care. So some will still want to continue to be in person, but there'll be others that really enjoy being able to sort of quickly sign on in between classes, or maybe not have to get up super early and shower and come down to the counseling center to see us. And so I imagine, our goal is that we're going to have a hybrid services where we're going to have a mixture of meeting students in person, and then if appropriate, they can continue with remote services. But again, that is something that we'll talk with the students and also sort of consult with whatever is going on with regards to CDC recommendations. But another good thing that came out of COVID-19 is that we really bumped up our availability of online resources. So we found that many students were impacted by these parts of COVID, like increased loneliness. We saw increased anxiety. And what we decided is that most of these students felt like they didn't need to meet with an individual provider. And I think that was true. But what they did need is sort of basic mental health education and training. So we took things like our anxiety and stress workshop, which we offer to people who are coming into the counseling center. They're able to attend this 4-session workshop, which has been really highly rated and students really love it. But what we did is we just recorded it and put it online. So really anyone, including parents, if you wanted to, have access to that anxiety and stress workshop and can take it without even having to step into our door or give us a call. There's also our Good Vibes series, which Jessica will talk about a little bit later, but really focusing on these principles of positive psychology and recognition that there's so much out of control during a pandemic. We sort of focused on what are the things that students can control that are going to make them be more successful, like getting a good night's sleep, like watching their eating habits, getting physical exercise, social connection, all these things. So really a wonderful series that I encourage you all to look into. And also on our website, we also have a general mental health resource page that has a lot of great content there for students who aren't necessarily feeling like they want to come into the counseling center. So another frequent question I get is, well, what are the most common things you see at the counseling center? And I think this is especially important for those new students coming in that I always like to point out, first of all, that our first year students are actually our biggest customers. we often see that most of the students who come in are experiencing things like difficulty adjusting to life at Bentley. And that's actually quite normal. In fact, if some students didn't experience some sort of distress or problems when they came in, I would think that that's probably unusual. So many of the students we see are sort of struggling with, is this the right place for me? Increased anxiety, difficulty getting sort of integrated into the Bentley system. And so I want to make sure that that's on people's radar, that our staff are able to help students with that. We also see a lot of students who are experiencing stress. Anxiety is a big topic. I'm sure that all of you have, or I'm not sure, but I imagine all of you are aware that many students are experiencing anxiety more and more. And so that's something that we certainly have professional expertise in. Depression, relationship, family concerns, substance abuse, grief, really, it really covers the gamut. Again, as I mentioned, our staff are experts in college mental health and have really seen it all. So I want students who are hesitating to come in to be sure that we can help them with whatever it is they're going through. So I know Julia already mentioned this earlier, but it's important to point out that our services are part of the cost of attendance. So students, if they're thinking it's going to be a barrier in terms of cost, it's not. You're not going to be asked to present insurance card. You're not going to be asked to pay a fee or a copay or anything like that. It's already been paid for. So that's always reassuring for students. Also, services are confidential. Julia also spoke to this. A lot of students, are going through certain things and they don't want their parents to worry about them, and they might be struggling with something, and so some of them are concerned that if they come and speak to one of our staff, that this is going to somehow get back to their parents or somehow get to other people. And it's important to reinforce that without explicit written permission, we are not allowed to even mention that a student came into our office. So I'm actually frequently get the call from a parent saying, "Oh, my son met with you earlier today, and I just want to mention something that he forgot to say." And if I don't have a written permission saying that I'm allowed to talk to that person, then I have to give my standard, "I'm sorry, I cannot confirm or deny if that person's been here," because we take that very seriously. And it can be a little frustrating because clearly the student has already spoken with you, and so it's not a problem. But I want students to be assured that we take their privacy and their confidentiality very seriously, and that we would not share anything without their permission. So that's also a reminder for you, if it is something where you feel like there's stuff you want to share with the counseling center, then I would encourage your student to sign a release giving us permission to speak. I also like to say it's not a part of the university record. It's a separate medical record. So that's something else that comes up. Our hours are also Monday through Friday, 8:30 to 4:30. Again, call the front desk, 781-891-2274. Speak to Linda. She's great. Again, she's the most pleasant person you'll meet at Bentley, or I'm a little biased, but and then I also like to point out, though, that it sounds like an arbitrary rule, but we insist that students make their own appointments. We found that often when there is some hesitance, that parents are often wanting to make an appointment for the student, and for a number of reasons, including the fact that students usually don't show up if their parents make the appointment. We require the student to make their own appointments. Another thing to be aware of is that outside of regular business hours, we do have after hours clinicians on call. So we recognize that mental health issues don't just occur within regular business hours. And so if you ever have a concern, or if you have a question, or if something's happening after hours and your student needs to speak to somebody right away, call our main number, 781-891-2274. And then I think you're able to press prompt. I think you press 3 and you'll be connected to our after hours clinician. So, I think that's important to be aware of. But if it's an emergency, like you're worried that something is imminently at risk, or there's a problem that needs to be addressed right away, then please call University Police, and the number is right there, 781-891-3131.
Perfect. Thank you, Peter. And I just want to say, I know that there have been a few questions that have come in through the Q&A, so feel free to type in those questions anytime. We are, again, going to devote some time at the end of this webinar to be able to answer questions more broadly. So similar to Peter's office, my department is also located above University Police. We are co-located in the same suite with the Counseling Center. And here is our phone number. In terms of the staff and who you find in our office, one thing to know is while Peter's team and Julia's team are often so very clinically focused, our team is the team that's usually most visible on campus. And we often serve as the ambassadors for students to all of the clinical teams. You know, students sometimes come to us because they are experiencing concerns and they don't know where to start. And we're able to do those warm handoffs to our colleagues because we're always the ones that are out and about and presenting. So in addition to myself, I have a health promotion specialist who has their master's in public health. We also, a couple years ago, were the recipient of a Department of Justice Office of Violence Against Women campus grant. So we have a contracted coordinator who is managing that program. I have 2 graduate assistants, and we have a team of 10 to 12 undergraduate peer health educators who are often out and about programming as well. So a lot of times people think about our department as the ones that cover some of the heavier topics. But I want to assure you that we utilize public health frameworks in order to provide programs and services that improve our students' well-being. And my team is really focused on using the evidence to inform and data to inform the work that we do. And so what we know from our regular campus needs assessment, that there are some core focus areas where our students consistently say they're getting tripped up, or there's something going on that's interfering with their academic success. And those include students' management of stress and anxiety, students receiving quality sleep and the ability to kind of manage their schedule and manage their time. We do often a lot of work for prevention and response to higher risk substance use. So students who might be using alcohol or marijuana in unhealthy manners. And we also focus a great deal of attention on relationships, talking about consent, talking about boundaries, as well as talking about sexual health. So we do provide some direct clinical services, and those really center around health coaching or substance use response. And so while I hope this does not happen for any of your students, if they do experience any difficulties or have any higher risk events when it comes to alcohol or other substance use, myself and Julia are often 2 of the professionals that our campus would be referring students to. And we take a holistic and harm reduction approach in terms of working with these students so that we can help them be preventative for reoccurrence of whatever issue they were experiencing. But in addition to that, my staff also provide individual health coaching around things like sleep, stress, fitness, time management, just anything that our students cite they're looking for a little bit of help in terms of setting goals and getting connected to resources that can meet their needs. As I mentioned earlier, we have a strong focus on prevention. So before your students arrive on our campus, they will be asked to complete 3 required self-guided learning courses. Your students will receive an email invitation to those courses next week. They cover alcohol and other substance use, healthy relationships, and diversity, equity, and inclusion. During orientation, we use a scaffolded approach, and we will build upon some of the frameworks that were introduced to them in these self-guided learning courses. And then after orientation, between our 3 departments, as well as some colleagues within student affairs on campus, we also provide ongoing skill building and services to, again, provide a more holistic approach to these topics. In terms of programming and initiatives this fall, I just wanted to highlight a few that we will be focusing a good deal of attention on. The first is bystander education. And these are trainings, we use a nationally accredited curriculum. And these trainings are essentially teaching our students how to look out for themselves and others and how to intervene in safe manners in order to prevent harm. We also, as Peter mentioned, are going to be putting a lot of energy into continuing the work of our Good Vibes series, which were very manageable skill sets that are known to bolster well-being. And last year we were able to present them with fun in a challenge format for our students. And we had a really high success rate and a lot of positive feedback from the student participants. We also offer a 4-week skills-based class on mindfulness and meditation, and our colleagues in spiritual life offer drop-in meditations on a weekly basis. My team of peer educators are going to be doing a lot of tabling and workshops on campus. One example of a very popular one is called Build a Better Bedtime Routine. We also are going to be doing pop-up tabling every month on consent and communication and healthy relationships. And then another program that we're very proud of is called Project Connect, and we'll be working with our new student programs department to build this program. Is an extension of your new students orientation. And Project Connect is a small group dialogue program where students commit to meeting with 4 to 5 other peers once a week for about 5 weeks. And they really just participate in kind of get to know you questions and dialogue. But what ends up happening is those students are building over time more deeper and meaningful connections with other students. And that's really helpful in combating loneliness and helping with their adjustment to campus. As I mentioned, we have 2 peer education programs. Some of you might have students who have been peer educators in high school or other community settings. Please encourage them to reach out to our office. We are going to be recruiting for both of these teams in the fall semester. One of the teams does focus more specifically on relationship and sexual violence prevention, and the other team focuses more specifically on the general well-being topics such as sleep, self-care, stress management. A few things for you to know. Some of you might have been through this before and have other children who have transitioned to college, and some of you, this is your first time dealing with a student who's attending a university. Just know that there's going to be ups and downs, and that's very natural as part of the adjustment process to campus. It's really important we often hear from students that they perceive that there's a lot of pressure on them from their families. And it's really important for you to be upfront with them and be realistic about what your expectations are for success, and expect that setbacks are going to happen. Sometimes we have really high performing students in high school, and their first semester in college is when they get a grade that's their first time getting a very disappointing grade in a course or on an exam. Those things are going to happen, and please help normalize them, but supporting your students through that adversity. Please also don't compare your students' experiences to what you're seeing on television, in the movies, or on social media. As a reminder, people naturally curate what they're posting and putting out there, and it's not necessarily realistic about what is actually happening. Help your students adopt a growth mindset. Also encourage your students to get disconnected from their devices. I know, we oftentimes have become more reliant on technology, but the more that they can disconnect from their devices and get involved in other activities and actually speaking with people, the more connected they're going to feel to our campus. A little bit more about that connection. I think sometimes we hear from family members that they're very concerned about their students' first semester or first year and really want them to focus on their studies. But what we end up finding is that when students are just focused on their studies and aren't necessarily getting involved through either employment or a club or an activity or leadership on campus, that those students are actually struggling more with their transition, and that they're not feeling like they've found their people or feeling like they've found a place for them. And so if there's any way you can encourage at least just getting involved in one extracurricular or co-curricular experience for them, it's really going to help your student out. If you haven't already done so, it's really important. You all are such great partners for the work that we're doing. So if you haven't done so, regardless of your students' choices and behaviors, it is important to have conversations with them about healthy substance use patterns, regardless if they choose to drink alcohol or not. We know from research, if you have conversations with them about what safe amounts are and some harm reduction strategies that they can employ, regardless if they do choose to drink, again, they're going to associate with peers who drink less. They're going to themselves, if they do choose to drink in more moderate fashion. And also there's a strong connection between these drinking behaviors and GPA. So, there is that academic consequence of these higher risk behaviors. Please also talk to them about consent and boundaries. I know we often think about consent when it comes to interpersonal relationships, but they're going to need consent from their roommate in order to borrow a t-shirt. They're going to need, consent in terms of things like how late the lights are going to be on in their room. And so a lot of this is modeling consent in all interactions and teaching students how to recognize those verbal and nonverbal cues when a person might not feel comfortable with something. Talking to them about sexual health and safer sex. Julia's team provides excellent care for our students. We do offer access to safer sex supplies on campus, and our clinicians will be ready to talk with students if they have any questions, but also knowing that, it's important for you to be normalizing these conversations. Sleep is another big issue for you to kind of talk to students about the consistency and quantity. And then finally, plans for managing stress. Asking your student, what does it feel like? What does it look like, when you're most overwhelmed? And what are the things that help you feel better so that your student is prepared to adapt those once they do transition to campus? I just want to leave you with a couple more pieces of information. First off, as Peter alluded to, our 3 departments have a wealth of resources online. You can access these resources anytime. And for those of you who do use social media, we do have an Instagram account for the 3 offices. So you're welcome to follow us and learn a lot about the different programs and events and activities that are going on within our areas. And then finally, just as a reminder, Julia went over some of the immunization requirements as well as the enrollment waiver requirements for the student health insurance. And as I mentioned earlier, we do have those required self-guided learning courses that were mentioned to students in the new student guide, and the information about those will be released to students next week. Please don't hesitate to reach out to any one of us. Even if you're not sure which office to call, we will hand you off and find the resource that is most appropriate to handle your concern. And I also want to point out, one of our team members that was not part of this call is our care team. We have a multidisciplinary team of staff members who do reach out and connect with students who we receive reports of concern for their emotional well-being. So just know that that's another resource for you on campus. At this point, we'll turn it over to our moderators to help manage any questions. Please let us know at this point in time if there's anything we can do to answer, or clarify based on the content we shared. Thank you.
Thank you all. Julia, I'll give you just a minute or two to speak a little bit to testing and vaccines if you'd like. I know there were a few questions in the chat, in the Q&A.
That sounds good. Thanks, Alex. Thanks, Peter and Jessica. I also just have to pick up on what Peter said about his wonderful front desk person, Linda. She is wonderful. And I also have to say our wonderful people at our front desk, Deb, Tara, and Sharon, will be happy to pick up the phone and speak to your student. And I say it somewhat laughingly, but I know at my provider's office, it really does make a difference when someone's welcoming your call, wanting to speak with you, and it's not a perfunctory answer. It's, I hear something going on and I want to help you. And I think all the staff at our centers are really student focused, health focused. So just needed to put a plug in there as well. And just on the immunization last slide, yes, students are probably running a little late on their routine immunizations. So I want to encourage them to get that information in, and the COVID vaccine in particular, the deadline is August 1st. People are wondering, some of the questions I've gotten in my email box was, well, I've started my vaccine series, but it's not going to be completed by August 1st. We'll upload the vaccine card that you have so we know that you're making your effort and you're making progress. We want to encourage that. If you've put in a waiver and you've decided to get the vaccine, go ahead and put that information into the portal so we know it, reach out to us. So that way you are moving toward that compliance. For folks who don't do anything, that is where you'll run into some issues and trouble with your housing, with courses, and we certainly want to avoid that for any of our students. There were a couple questions about testing, so I just want to review that our plan right now is to continue our partnership with the Broad Institute and provide PCR onboarding testing for all of our students. I don't want to get into too much detail. All of this information is on the Back to Bentley site, but essentially anyone who is traveling internationally are bound by those CDC guidelines, which means you do need to get tested. There's upon arrival within you have to show a PCR test upon arrival, a negative test, and then you'll be tested again within 3 to 5 days. If you are vaccinated, you do not need to quarantine. By CDC travel guidelines, if you are unvaccinated, you will quarantine for 7 days. For our international students, we will allow you to leave that quarantine in order to get vaccinated at the clinics that I mentioned. So some of our international students are arriving in August, and we're going to have some clinics available for them. In terms of screening going forward, as we all recall, we had a different cadence of screening throughout the year based on what the local rates and what the rates were on campus. Right now, our plan is to do that arrival test for everyone, likely do screening for our entire campus for a couple of weeks. And based on what's happening, we'll monitor that data, and we will continue to test all of our unvaccinated individuals where there should not be very many, given the vaccine mandate is for students, faculty, and staff. But anyone who is unvaccinated will continue to test. And otherwise, we will likely see our screening testing going away if conditions allow. Other questions that have come in?
Perfect. Thank you, Julia. Yeah, it says, if vaccinated, will parents be allowed to move in students as usual?
That is a great question, Lori, and it is being discussed in earnest. Given the recent increase in cases of the Delta variant, we are all looking forward to a much more normal semester, yet we do still need to be very safe and careful. So there will be, I would glue yourself to that Back to Bentley site, because that information will be coming out there, and it will also be coming from Residential Life. In the past, yes, parents would move their students in, and I know I dropped my daughter off at camp this year and I did not see the inside of her cabin. I got to pretty much open the car door, she jumped out, we waved, and pickup was the same. So we'll see. We're hoping that we can get this campus as safe as possible, and that means making sure that people are vaccinated, that we're doing screening testing, and the move-in process will still continue to be looked at very carefully to make sure we're making good decisions around starting off on a really safe foot for our year.
Perfect. Thank you, Julia. We don't have any questions right now. We can give like 2 minutes, and then if there's no questions, we can just end a few minutes early and give our viewers some of their time back.
Jessica, I'm always excited to hear about some of the programs that your peer educators do on campus, because you're right. I think Peter's staff and my staff were often in our centers seeing students coming in, and you're maybe more out on campus, and it's always great to hear what programs you're bringing out to our students.
Yeah, so I'll start with the RSVP educators. So this year, they're going to be taking a beloved tradition on campus known as Consent Day. And they're actually going to be taking basically every other week, they're going to be presenting an activity to students that focuses on either healthy relationships or some aspect of relationship violence prevention or information about kind of coercion. So some of these really heavy topics that are often difficult for students to kind of recognize or identify, talk about, and they're going to actually be presenting in a fun way to help students be able to build the skill sets to identify these, or be able to build the skill sets to intervene. And so we're really excited because it is going to be incentivized, in that if students kind of visit a select number of those pop-up kind of consent events, they are going to be eligible for a very popular incentive, which is the Consent Day t-shirts. We've got the RSVPs, as I mentioned, who are going to be doing tabling around like the Build a Better bedtime routine. They have a whole series known as on self-care, where they have a mascot whose name is Self-Care Bear, because we love rhyming. So they're going to be doing weekly or bi-weekly activities as well. So we're really focusing more on smaller kind of tabling type events that are going to be bringing students in that allow for safer interactions than if we were in a room with, 40 students at once trying to do an activity. So those are just a couple high-level overviews.
Thanks, Jessica.
Okay, well, we don't have any questions and it's been a few minutes. So I just want to thank everybody for joining us. And I want to thank Peter, Jessica, and Julia and Katie for joining us. As always, if you have any questions, feel free to contact the Health Center, Health and Wellness and Counseling Center, or if you have questions about movement or orientation, you can contact the Residential Center and Orientation. Thank you all for joining us, and we are excited to see you all in the fall.
Bye, everybody.
Good night, everybody.